on the top of, like above his arm. So on the lateral aspect of his arm, I'm adding a posterior inferior glide. And then what I'm gonna have him do is push his wrist into my bicep. So you're gonna externally rotate, push your wrist into my bicep. And I'm gonna act as a leverage, like a lever. So my hand is on his elbow and I'm using my body to rotate him forward. So essentially he's doing, like, I'm trying to put him in an internal rotation and he's pushing me into external rotation, okay? And so we're doing these within varying degrees of external rotation as we go through. So the way I'm gonna position my body will be different. Like he'll have to rotate his hand into my forearm as I go, and so I'm pushing into his elbow, and I'm just trying to, like, you're not actually gonna move on this one. I'm just demonstrating just so it looks like I'm not doing anything. But I'm having posterior inferior glide. Go ahead and rotate out, and I'm stabilizing on the elbow, and we're gonna hold that position. And then we're going to maybe go into a little bit more external rotation. Okay. You're gonna go ahead and push into my forearm. Good. I'm sorry. I'll come from this side now. All right. Posterior inferior. Go ahead and push back. And then I'm external rotating. So after you if you're, let's say that they have pain here, right? Anterior shoulder pain when they're in external rotation. I'm gonna start them out of that range first. And I'm gonna start with isometrics more in their mid-range. And so that's where I'm doing this type of handhold placement. So I'm inferior gliding them, they're pushing out in my bicep. Because I feel that I can get a better mobilization in this standpoint, in this position here. The issue is that when he goes farther, I'm obviously in the way, right? And I want to get to this point, so I'm gonna have to change my body position here. And so I use my thigh to stabilize the elbow, and I can add that glide, but the problem is, as you can see, I can't get the inferior aspect going, right? So I try my best, but that's the thing that's lacking. So I'll hold him, and then go ahead and push back. And then we're doing about 10 to 30 second holds. It depends on how much resistance he can give you and how much I can give him. I'm gonna work up to 30 seconds. Just that transition to try to get to more time. And then we're gonna move back a little bit farther. Go ahead and push. And when you go farther back, you're gonna get more awareness to the posterior part of your shoulder. And then I'm gonna go up into more advantageous positions, more risky. So notice how you're a little weaker there, right? So go and push. So I'm not gonna try to win. I'm just gonna meet his resistance for this one. Okay. So I guess I kind of went through 1 through 3 all together. I forgot the internal one, my bad. So the internal one, because when you're doing the first one, the posterior inferior glide, I'm starting here, okay? So just to orient you guys, this is 1, okay? 2 would then be, I'm doing internal rotation, so I'm sorry, I missed this one. You're in this position, you're in internal rotation, because you're trying to protect that from that more exposed position here, okay? So you're trying to stabilize from the anterior side, so stay relaxed. Go ahead and internal rotate. Good. And then relax. Go again, internal rotate.
You're still adding that
relax.
inferior glide?
Yeah, it's a posterior glide on this one. Yeah, this is number 2 on the manual therapy for anterior shoulder.
Okay.
Go ahead and internal rotate. And then relax. Internal rotate. And relax. And then we're working our way back on this one. But I'm still adding this posterior glide. Okay. Relax. And then we're going to work all the way to the end. So just say we work all the way back there. Go ahead and push. And again, it's anywhere from 10 to 30 seconds that I'm working through this. And then once he's at the end and he does his 10 to 30 seconds. You're gonna relax and then you're gonna switch, externally rotate. And for this one, again, I'm gonna work out of this, but working on more external rotation emphasis and the centration aspect. Like, let's say he can't get, especially for this like external rotation, you're starting to like now that he's pushing back, you feel him push, like his humeral head pushes more into your hand that you're posterior gliding. You can add an axial force with your hip here, just like how we did before with the unstable shoulder. You can add that axial force for centration there, or you can come out of that externalization and then start and move back into that again. So this is where there's like a qualitative and like a feel here, is that if you're eventually you need to get back here and work on external rotation out and back in this position to help with his external rotators stabilizing his humeral head on the glenoid. But if he's continuing to pop up here himself, then like obviously manually can stop that, and we're working on that so that way when we get through the actual exercises, we have a better chance of achieving that goal. But we might need to work in more mid-range first and then work our way back out. So again, there's a little nuance there, but the idea for doing the internal rotation first, moving into external rotation, is the fact that we're trying to promote those anterior stabilizers to to seat the humeral head inside the glenoid from the anterior portion first. Okay. And then for motor control, we're going to do ER and IR isometrics and more flexion, and progress to more end of range internal rotation. So as you can imagine, if this is like the more provocative position, we want to try to get out of that. I think we've like kind of done a good job talking about like how you want to like close down the joint more. And so we can think about any sort of exercises that have that component. And so I'm going to show you a couple, but I challenge you when we break out into groups, like think about other ones. Okay? Yep.
Yeah, so before we move into, I think you're about to transition into the exercise component.
Yeah, you want to just manual?
Was that? No, I just had a couple questions
Oh,
with the manual. So if we look at 1, 2, and 3, right, so there's varying degrees of external rotation. You're talking about range of motion.
Mm-hmm. Yes.
And then with numbers 2 and 3, you have IR, ER emphasis. And again, is that talking about degrees, or is that talking about the muscle contraction?
The muscle contraction.
Right.
Muscle contraction.
Just
Yes, thank you.
wanted to
Thank you for
clarify
clarifying that.
Yep.
Yep.
And then in our first phase 1, the one unique thing is that instead of pain with internal rotation, now I'm seeing pain on the anterior shoulder.
Mm-hmm.
And so one was with a range of motion, and now one is with a pain of location. Can you just help to clarify that?
Yes. So now that we're in phase 2, range of motion should be cleared up. And so once that is cleared up, then you are transitioning more towards like now addressing where their pain's actually at. Because what as you saw from like the previous phase, or from if we look at the clinical milestones, let's go back here.
The PDF, the red one.
So if we go back to the clinical milestones here, it's 80% in phase 1 to move on to phase 2, right? So you should be able to get into a comfortable position to move on to phase 2, but you're still working on range of motion. So if they're not fully getting that range of motion yet, you're still staying in like somewhat of like, this kind of answers your question. You're still working on the range of motion to maintain that, and you can like, you have like your solid exercises that are working like towards like building that mobility. But the thing that like kind of helps bridge that gap is like, allowing for more of that posterior joint mobilization and centration. So I find that the last 10% sometimes, like although there might be a capsular restraint that occurs, is more of the ability to centrate the joint. Because if you don't have good joint centration, then you can't get proper spinning of the actual glenohumeral head, or the humeral head. And so the difference for, at least for this one here, is for the pain of the anterior shoulder is now like when we go to these end ranges of motion, there still will likely be some sort of discomfort. And so that's where we're stratifying between those two of like which where do we go from there? If they don't have pain with that, then you probably need to go to the strengthening phase. If they meet those other KFIs. Is that good? Thanks. All right.